Year-old usually can ride a two-wheel. Is that true?
Yeah, they should start being able to learn to. And a lot of that is a matter of being taught. If a child's not taught to, sure, they won't be able to. But if, with some work and some encouragement by the parents, they should be able to learn that.
And they can sort of tell you, oh, I don't like that. Some negative thoughts, they can express it in a pretty good way now. Is that true?
Yeah, and they're going to start, demanding things, and they're going to start refusing and seeing what happens when they refuse parents' wishes. And this is, again, another just opportunity for parents to teach them how to be better members of society and contribute and respond appropriately.
When they get to about 9 or 10, okay, at that point, they get very coordinated. They have ideas and interests of getting better structured.
Right.
They can use references, books, whatnot. The skills are getting better. And they're about to go into a new age,
right,
the dreaded age,
right,
very soon, of adolescence. Is that true?
Yeah, and it's even been, there are new terms developing, like the tween age or whatever it is. And a lot of times in our society, the way children are developing, adolescents.
You call it the tween age?
The tweens, yeah. It's a new term that people are using, where people have been noticing that teenagers, that the preteens are acting like teenagers are acting. And even at 10, 11 years old, look, a lot of 10 and 11-year-olds already have cell phones and are playing video games and going out with their friends. And there's a lot of pressures from school and a lot of and a lot that we expect from children nowadays. And it's important to realize that parents don't always realize that these 10 and even 11-year-olds are being exposed to a lot of things that we weren't exposed to on before 16, and recognizing that and talking with parents. A lot of times now you see these billboards and
so they grow up too quickly. Is that true?
Children. Sometimes it could be too quickly, and social development is very important at this age, and it's going to affect their life, social skills, and it's very important for parents to really be talking to them at this age about peer pressure, about drugs, about, sex, alcohol, all sorts of things that you'd never expect. They're only 10 years old, but they're really starting, by 11, 12, they're really getting into this. So if the parent talks to them first, it's something that's going to be very helpful for them.
A good parenting rule is create a situation you can talk. Don't yell. If they do something inappropriate and they come to you and you hear it, not from another source, you can't get crazy. They'll never come to you again. Is that true?
Yeah, your first reaction is going to tell them what they can do next time. So if they come and tell you something and your reaction is something that they don't want to see again, they're not going to come to you, the next time they have a question or they have an issue. If your first reaction is very supportive and reassuring, of course not allowing them to do everything they want, but just teaching them in a way that's comfortable for them, that they will be able to learn properly, that's going to be very constructive for the next coming years.
If anybody hears about the growth and development of children at our website that doesn't have children, don't listen to this. You may not want to have children.
Right, yeah. Look, and don't forget, teenagers can be very difficult. There's a lot of issues going on, but they also can be very enjoyable. And it's, the younger age kids where you were spending most of your time disciplining and toilet training and getting them to do their homework, now you can start developing more of a relationship with your children and going on trips together, family, time together, and it's really helpful for children.
So the best rule, communicate, don't lose your cool. It's a very difficult ride. If a kid doesn't do something exactly what we said or the books say,
right,
look at the overall picture, and most likely your kid will be okay.
Yeah, sure.